most important tool and most effective tool, and then yet the utilization is not there. And one of our goals also is to increase the awareness of how effective this tool is. Now, when we say comorbidities, we are talking about other diseases comes with morbid obesity, because morbid obesity is never by itself. There are situations that may be some exceptions, but when people have morbid obesity, usually they have hypertension, hyperlipidemia, they have diabetes, they may have refluxes, heart disease, sleep apnea, so many other problems comes with. And when we took care of the issue of morbid obesity with the most effective way of which is bariatric surgery, now there's an amazing result that we see, the resolution of these comorbidities. So that's where we actually want to kind of focus on today. Now, Dr. Irgau.
Absolutely, Kemal. So it's obviously a very, very important topic. You know, when we look at bariatric surgery, at what we do in our center, clearly and almost naturally, people focus us at the most obvious result of what we do, right? So people come very, very overweight with severe obesity. And once they've had the operation, you know, sometime later, that weight is gone. So the most obvious, the most visible result of what we do is weight reduction, right? Somebody who was very overweight, and you could obviously see that in their appearance. Now they've lost 100 pounds, they've lost 120 pounds. They were going to be looking completely different. That's the most obvious and the most outwardly result of what we do, right? But clearly, what we do is way more than weight reduction, right? As we've said it time and time again, and that is improving the health of the person, right? In a tangible way. And that's what we're going to talk today about. Risk of many illnesses related with weight, with obesity actually decreases, or illnesses that have already developed in that person will go away as well. It is interesting, actually, the last patient I had today in my office hours, around 1:30, a person, you know, who weighs about 285 pounds, and they would like ideally to be 150 based on their height. We were discussing weight loss surgery, the options, and they asked me whether their risk of diabetes will go up after they've had this surgery, right? I said, on the contrary. In fact, I want you to actually, if you have time, watch our session today on Bariatric Friday on YouTube, and I hope they are watching, because I said we will actually be discussing this very topic, what happens to certain illnesses related to obesity. So on the contrary, of course, rather than increasing the risk of diabetes after weight loss surgery, not only the risk of type 2 diabetes goes down, but also if a person already had type 2 diabetes, that is likely to go away or improve considerably. This is very important. It has really marked a shift in the interest of many doctors now referring their patients for bariatric surgery once they have discovered that it's not just about reducing the weight of the person, it's actually making them healthy as well, right? If you're a primary care doctor and you have a patient who is about 100 pounds, 150 pounds over their ideal body weight, they're going to come to you not only with the burden of that weight on their daily to-day life, but also with illnesses that are associated to it. So the likelihood of that person having type 2 diabetes is high. The likelihood of that person having high blood pressure is high. The likelihood of that person having sleep apnea is high. So as a primary care doctor, what would you be doing would be prescribing medication for each of those illnesses, right? Once you discover that actually those illnesses are closely related to the weight, then you will be going for bariatric surgery as the solution, right? Because once you address the weight, then you will be addressing those illnesses as well, right? And doctors really discovered this, Kemal, in a very clear manner when in 1995, there was a publication in the Annals of Surgery. That publication came from the University of East Carolina, and it was authored by Professor Walter Poirier and a team with him. And the title of that paper was actually much more unusual than most scientific papers. The title was, "Who would have thought it? ? An operation proves to be the most effective therapy for adult onset diabetes," which is another way of saying type 2 diabetes. And what they've done is, at that time, which is 1995, reported on a 14-year experience doing gastric bypass surgery. As you can imagine, in those days, gastric bypass was being done in an open fashion through a very big incision. And they were not doing all that many operations compared to our, the operations that are done now. In fact, over 14 years, they had 608 patients, which is the number of patients which probably we will do in a year and a half in our surgery center now. Anyway, what they've reported, Kemal, is that of those 608 patients, about 150 had type 2 diabetes when they came in for the surgery. And then when they followed them up after they improved, recovered from surgery, of those 150 patients, about 121 had total resolution of their diabetes, 82% of them. And because type 2 diabetes was supposed to be a chronic illness that never goes away until then, but then they have proved that this operation, gastric bypass, actually can cure type 2 diabetes. And the main purpose of their paper was to show how type 2 diabetes could actually be cured with this operation, but also they listed a number of other conditions that these patients had alongside type 2 diabetes that also improved, including high blood pressure, including sleep apnea, including heart disease, sometimes congestive heart disease, arthritis, joint pain that these patients had. Many women, young women who had infertility as they came in for the operation, their fertility level increased. So infertility was also being treated. And of course, since then, we have been able to reproduce these results with larger and larger study. And of course, we know from our own experience, when we see our patients coming in for surgery with all these medications for all these illnesses, once they have bariatric surgery and they start losing weight, we see improvement in these illnesses and decrease in the number of medications.
Of perception and how this is a really effective drug. In fact, we use these drugs for patients who are going through the surgery because we want them to be at a lower BMI. So there's a special diet that they have to do to shrink the liver a little bit anyway, right? So even that time, they lose maybe half of what the drug would do in 6 months. In 2 weeks, that diet does hit you with 20 pounds. Many of patients are losing. So then again, okay, so did you miss something? Or did people miss something? So then usually people are missing stuff. So I want to make sure that we kind of discuss when is the right time, and not just the right time, but how is it an alternative to the surgery is the key. And the answer is no, but I want you to kind of, maybe elaborate in a way that, everyone can understand.
Absolutely. So like any disease process, Kemal, it all has to do with understanding the severity of the disease, right? So when we talk about weight-related, disease, we talk about different degrees of severity of the weight issue, right, Kemal? We talk about somebody being overweight if their body mass index is, between 25 and 30. And then we talk about class 1 obesity if the body mass index is between 30 and 35. We talk about class 2 obesity if the body mass index is between 35 and 40. And then over 40, we talk about morbid obesity, right? The clinically severe obesity. So obviously, the levels of morbid obesity can be variable as well. You can have somebody with a body mass index of 45. You can have somebody with a body mass index of 60, as you say. We see patients even with higher body mass indices than that, right? So the question is, what treatment is appropriate for which body mass index? That would be one question to answer. Clearly, if somebody has class 1 obesity, a body mass index of 32 or 33, Kemal, that patient could do very well with a medication like Ozempic or Wegovy or Mounjaro to get their body mass index within a normal range, and they will achieve that, right? So that would be an appropriate indication. In fact, even before the appearance of these medications, currently we don't consider somebody with a class 1 obesity as a candidate for weight loss surgery, right? We talk about surgery being appropriate for severe forms of obesity. So traditionally, surgery has been indicated for people who have a body mass index of 40 or over, or sometimes a body mass index greater than 35, but with the development of illnesses like type 2 diabetes, high blood pressure, or sleep apnea. So clearly, the place of medications to induce weight loss would be best suited in places where we are looking for modest weight loss to achieve the results that we wanted. As you correctly said, if you are 210 pounds and you're 5'5" or 5'6", if you were to get a medication that reduces your weight by 30 pounds, that would be a good result. There is no question about that. But if you are 300 pounds, if you are 350 pounds and your body mass index and your height is still 5'5", Kemal, losing 30, 40, or even 60 pounds with the best results that have been reported with medications, you would still be very, very high in your weight, right? If you are 5'5", with an ideal body weight of 150 pounds, but if your current weight is 300 pounds, and let's say you get, the most effective medication right now would be Mounjaro, right? Which has been reported as showing up to 20% weight loss in some patients. Well, with that result, somebody who is 300 pounds would be losing about 60 pounds. If you're 5'5" and lose 60 pounds from 300 pounds, you would still be 240 pounds. Come on, you would be at least 100 pounds away from your ideal body weight, right? So when you look at bariatric surgery, that same person could be losing, double that, up to 100, 120 pounds, which would bring their weight considerably lower. So for somebody who is with that high of obesity, clearly, even with the most effective medications, they would be better off with bariatric surgery. There's no question about that. That is really what the facts are right now. Come on. Having said that, patients may still be reluctant to undergo surgery as the first option, just because, people have different notions about what bariatric surgery may be, but also because they themselves need to be comfortable with the idea of surgery. So even if a patient with a high body mass index, if they are not ready to have surgery, I think it's appropriate for them to still have medications as a way to at least counter what they have right now. Even if they have modest weight loss, it's still better than not. But also it may be protecting them from further weight gain as well. However, there are limitations with medications as well. First of all, you have to be on those medications on a continuous basis. The minute you stop the medications, the weight tends to come back, right? Also, there is tolerance of these medications. People may have side effects related to problems with gastrointestinal symptoms, whether it's intestinal cramps, whether it's nausea and vomiting, or even more serious problems like pancreatitis. They can occur with the medications that may not make it suitable for a person to have those medications. Having said that, there are obviously complications with surgery as well, and we talk about complications in our sessions. The complications of surgery tend to be much more defined, because now we have how much experience we have with weight loss surgery. Come on, 40 years. That's a long time. And bariatric surgery, because it had to go through so much scrutiny to legitimize itself, bariatric surgery is probably one of the most heavily studied disciplines in medicine, right? We had to make it really super safe for us to legitimize the discipline itself, right? So we have 40 years of experience with bariatric surgery, but with the newer medications, we don't have that much knowledge come out. Our knowledge is obviously limited to the periods it takes for the trials to occur. So they have their own place. For modest weight loss, clearly medications will be appropriate. But when you have somebody who's struggling with body mass indices like the one you're mentioning, clearly the most effective treatment that we have remains still better.
View perspective. Sometimes, you probably know this the most because you probably spend most time with me among my friends. So I always use this perception versus perspective. So we are talking about perspective, and I was just double checking if I put it right in because sometimes like we kind of we go between the two terms, and many people they have a perception rather than having a perspective of the issues. And this is again where we make where it becomes more difficult for those individuals because the decision of surgery, like you mentioned this event, someone was going there, and like what we understand is all of us, you, me, and others who may have the who may be struggling with obesity or not, we always make adjustments based on how much we walk, how much exercise we do, how much we eat, when we eat. So, and we all have good and bad habits. So, as you know, I always volunteer my own confidential, issues from my life in this event, just so that people understand that this is real. So like last night, we went for an event. We went to this event, a couple of people from my office, they were with me. And then if they are watching this, which I know that they are, so they will know that I was cheating. Before I left my house, so this was at 6:45, 7, so we were there probably by 7:15. One thing that I knew that there were alcohol in this event. So then I don't eat anything throughout the day. So then because of the intermittent fasting, again, now, like, look, the life is already kind of put it in different, like my days already kind of in different segments. So they're almost 12 to 2 p.m. I don't eat anything. So that puts me almost like 15 to 17 hours fasting. Mm-hmm. But I still have to, prepare myself for this event, not to worry about what to wear, but how I won't actually get drunk, because with the empty stomach, if I have one or two, it will make a difference. So I have to prep for that. Mm-hmm. My prep is having 3 egg whites. Mm-hmm. So now, one, it didn't actually, it hold me up because I also don't want to eat there. Now, I'm gonna, again, I will be honest. So at the end of it, what I ate wasn't maybe something that I would be proud of, but I was able to go through that trouble of the event food and also prep for what I may be drinking. So then I'm prepping myself for what's coming. Mm-hmm. So this is kind of maybe the perspective that we need to make people understand. So this is like you estimated my BMI the other day, somewhere from 29 to 30, and it's probably around like 29 these days. Mm-hmm. So, and I don't feel like I'm close to that other side of it yet, right? Mm-hmm. But then if you ask me, that's so far away from me, but it's really not that. So right. Because I still have the same clothes, the same size that I'm my dress size didn't change. Mm-hmm. I may be able to gain, maybe I might gain 25, 30 pounds, where I'm still able to fit into the same clothes. Mm-hmm. So that's the kind of like the perception becomes the reality in some cases. Like you are thinking that, oh, well, I'm still size 54. Mm-hmm. Well, but now maybe you are more full in that 54 than before.
Mhm.
So then you are creating a perception in many cases. But my point by sharing this yesterday, I had to prep for that upcoming
Mhm.
event.
Mhm.
And this didn't include anything regarding how I'm going to look, but it was more about what my body needed. So then I didn't want to just eat some of the food that they had there.
Mhm.
And again, so at the end of the night, maybe I could have a little bit better choice. So I won't mention what I ate, but you get that from your kids every once in a while when you leave Saturdays, Friday meetings.
Mhm.
So
Mhm.
play don't go too.
Mhm.
So,
Mhm.
but
Mhm.
maybe I failed at that point, right? But I know
Mhm.
that I did really good up to the point of that time. So that was 9:15.
Mhm.
So, and if I didn't have those 3 egg whites,
Mhm.
it could have been even worse.
Mhm.
So there is this prep that's required for all of us.
Mhm.
So that's one thing that I want our patients or people to understand. So this is not about this individual or that individual. One of the people who were with me, and just because she may not want to mention, she may not want me to mention her name. She says Monday through Friday she does CrossFit. It's like weekdays, Monday through Friday, 6 a.m.
Yeah.
She's
Yep.
she's almost at a pro level tennis player, and she's in great shape. But
Mhm.
that requires her to get up at 6 to
Yep.
do CrossFit training.
Yep.
Is it CrossFitness or CrossFit? CrossFitness, right?
CrossFit. CrossFit. Yeah, you're right. Yeah. You're
Training
absolutely
for an hour every day. So you
Yeah.
see like how much. And then I was one of the observations that I'll tell you, she didn't make the same mistake that my other employee who was with me. He and we kind of failed, but she had only one of the things that we were eating. We had three different items. She had only one. So then I see that as like, okay, so this is how people are also, we make our choices. I could have not done what I did, but if I didn't see what she did, then I wouldn't maybe even have this talk today. So this from a perspective point, we really need to have a heart-to-heart talk. So put our head in front of us and then say, okay, what's going on in my life and what's going to happen if I go through this program? So we just want to kind of like put that out there for our patients.
So that's a very interesting point, Kemal, and this is really right at the heart of the perspective of our patients and also the community, society at large has about obesity, right? We think that our body is neutral when it comes to weight gain or weight loss, right? That is really the fundamental framework with which we look at obesity. We say, okay, you know what? If you do XYZ, you will lose weight. If you do XYZ, you will gain weight, right? Actually, it's not true. Our body is not neutral when it comes to weight. Our body is designed to favor weight gain by far over weight loss. And we all know this. And you actually very much exemplified this with what you just said, right? When we try very hard to lose weight, Kemal, and we stay disciplined, whether it's doing CrossFit, which is extremely hard and requires a lot of discipline, or do intermittent fasting, for hours on end when you're surrounded by food continuously, this requires a lot of things. The actual result in terms of weight loss is minimal, right? The minute you fail only one day, the weight gain is much, much higher. In other words, it takes one weekend of failure, right, to regain the weight that took you 6 months to lose. Just think about that.